Hello everyone, and welcome to the Quillen Physicians webinar on charting for physicians and residents. When you first log into Allscripts, you should default to your daily schedule. To access a patient from this schedule, you'll simply double-click on their name, and this will pull up their open chart, which is called the clinical desktop in the system. Now, to start a note on a patient, you're just going to click on the Note tab on the horizontal toolbar, and a Note Selector field will come up. The specialty should be defaulted in, as well as your own name here. Now, if you're a staff physician, you'll just leave this as is. However, if you're a resident, you are going to need to put your preceptor's name in here. So you would just type in their last name, choose the correct physician, and then just click OK. Only staff physicians can sign off on and finalize notes, so residents will need to pull their preceptor's name in there. The visit type can be changed by clicking on the drop-down arrow and choosing the appropriate visit type. And as you see here in the chief complaint section, we already have a chief complaint loaded in here, and this is the information that the nurse has put in on the patient. If you need to remove one or add another chief complaint, you just click on the blue hyperlink. You can choose another chief complaint and add that in, and then just click OK. And at this point, your note authoring workspace will open up. Now, I know this is a very busy screen, so I just want to go over some of the elements on here real quick. On the history of present illness, over here in this left-hand panel, you'll notice that there are all of these sections that you usually see in a note listed over here, and we refer to this as the table of contents. Okay, so you'll have history of present illness, review of systems, active problems, past medical history, surgical history, and if you'll notice each time I click on one of these, over here on the right, it automatically takes you to that section of the note. This right-hand section is where you will actually be documenting the patient's visit. However, we do suggest that you get in the habit of navigating through the note by using the table of contents. It's just easier than scrolling up and down and having to open up all of these individual sections. So it's a little bit of a time saver there. And this section down here is called the Note Accumulator. And as you'll notice, if I go in here and start clicking on some of these radio buttons to document the patient's condition, the Note Accumulator will automatically populate with the information as you click on these elements. And this is what will actually become your dictation. You can also free text in here just by clicking somewhere in the field and typing whatever it is that you want to add. Okay, so let's get started here. When the patient comes in, you're going to click on the history of present illness, and as you notice here, several forms have pulled in. Okay, we've got ADHD, anxiety, breast pain, asthma, and headache. Now, these forms pull in from two different areas, the active problems and the chief complaint, and both of those sections will be filled out by your nurse before you get into the room. So, you know, the chief complaints on this patient were anxiety and breast pain. The asthma, headache, and ADHD are pulling in from the patient's active problem list, which you can see right here. Of course, if you aren't addressing any of these active problems on the current visit and you're just addressing the two chief complaints that the patient came in for that day, you can just ignore these other forms and just go ahead and document the information that you need on the chief complaint. The review of systems, this form pulls in based on the patient's gender, so you will have either complete female or complete male, and you will document this the same way. If you do a complete review of systems and you ask the patient all of these questions, if everything's normal on each of these sections, you can just click normal, and as you notice, it populated down here constitutional normal, eyes normal, ENT normal. If, however, one of these items is abnormal, what you'll need to do is go ahead and click on the one that's abnormal, And on the rest of them, if the rest are normal, click these individually. If you go ahead and click the All Normal button and then click Abnormal on one of these, it comes up a little strange in the note accumulator. I'll show you what I mean here. So on respiratory, it said normal and no shortness of breath. So it's not recommended that you do that. It's recommended that you click on these individually if there is one abnormal within that section. And again, you can take a look at the patient's active problems. If you want to address one of these, you can either do it by clicking on the form and addressing it that way, or you can open up the plus box and then hit Edit. And this brings up a details screen, which allows you to change the status. You can change the problem from chronic to acute. You can add free text here. You can do a variety of things on these problem details. And anything that's accumulated in these sections, whether it's a past medical history, a surgical history, or whatever, you can edit. You can also add a new problem in any of these sections just by clicking New. And this will pull up your, we call this the ACI form, the Add Clinical Item form, and you can add information in here. So let's just click on some of these. You can see how this is populated. And this, of course, is the information that your nurse would have put in prior to your going into the room. Social history. You can look at the patient's current medications, allergies, immunizations. This comes up with a handy little graph. And the patient's vital signs, which will have the current encounter, plus I believe up to 6 previous encounters. So you can very quickly look at their vital signs over the last several visits. Now on the physical exam, this works pretty much the same way as the HPI and the review of systems. If the constitutional is normal, you just click normal, and it populates general appearance, no acute distress, well appearing, and well nourished. If something is abnormal, you can click abnormal. And if you see this little radio button over here, if you click on this, this will pull up another details screen where you can document the abnormal findings. And you'll find that on the review of systems form. You'll see these radio buttons here as well. All of these will pull up a details form, as well as on the history of present illness. Some of these forms will have radio buttons. It just depends on the symptoms. So that's what those mean. If you see that little radio button, that just has additional details that you can open up and click on. The physical exam form also has a section where you can free text. So if there's something additional that you need to add that isn't on the form, you can add that in here. Or again, you could just click down here and add free text there. Now, I'm going to say a brief word here about the procedures. As you can see, there are several procedure forms already built in here. And we did this, we've asked each of the individual offices what their top 10 procedures are, and we've gone ahead and added those to the form so that you don't have to spend a lot of time searching. So if you have performed one of these procedures on the patient, you just click on that and you can fill out the form. Now if you want to add a procedure and it's not listed here, you can right click on the section, you can add form, and you can choose from a lot of different forms. You know, if you want to do a hearing acuity test on this patient, you just click that, pull it in, and there's your form. And you can do that on all of these sections. So if you want a more specified physical exam form, if they have some abdominal complications and you want a more specified form for that, you can pull that in. Just right click in the section and add form. Now the assessment, as you can see here, these are all of the problems that were assessed at today's visit. You can also add a new problem if the patient came up with something after you had started the note. So let's say you also addressed acne at today's visit. Just choose that, click OK, and it will pull in here in pink. Everything that you add at today's visit will pull in pink until you save the changes by hitting this commit button. Now if you add an additional assessment, you're going to need to recompile the note by clicking on this down here. And what that does is it sort of resets the form so that when you go to order, if you need to go order medication for the acne, you can link it to that particular problem in the RX portion of this. And we'll go over that in a different webinar. So you can also make additional edits here by clicking and then clicking edit if you want to add some additional information. The plan, and this is where you're going to go ahead and order any medications, labs, imaging. You can order a follow-up visit or order a referral for the patient. This is patient instructions, immunizations, supplies, or if you actually administer medications there in the office. You will do all of that from this screen right here. And again, we're going to cover that in a different webinar, as that's a little involved. But that's where you will do all of your ordering for the patient. Now once you're finished with the note, which by the way you can view the dictated note just by clicking view here, and this is what your dictation will look like. The things that are abnormal will come up underlined and in red, and that's what your note will look like. So you can look at that before you actually get out of the note if you like. Once you're finished, you can do two things. You can either save and close, which saves the changes to the note and gets you out of it, but it doesn't finalize it. So if you think you might want to come back and add some additional information, use the save and close option. If you're finished with it and you're signing off on it, you're going to hit sign. It should come up password not required, and then you're going to click OK. Now for residents, because residents are not allowed to finalize a note, what will happen is they can sign it, they'll get out of it, and then a task will automatically be generated to the preceptor, who will then have to go in and finalize the note and sign off on it themselves. So that's how that works. Once you sign off on it, you're going to get an encounter summary, and this just shows you everything that you've added into the patient. The new things are in pink, and if you've looked at this and you're happy with it, everything's the way you want it, you hit save and continue, and it will take you back to your daily schedule. Now if you want to go to the chart and just kind of double check and make sure the note is there, click on the notes section. I'm going to go ahead and change this to all notes, as it should be the first one that comes in. And here's our note. Establish patient visit on today's date, and there's your dictated note. And you can close out here. So that is basically it for charting. I hope this has been helpful, and if you have any questions, please feel free to email us. Thank you so much for taking the time to view this. Have a great day.